Hi, I'm Dr. Amber. I'm here to help you understand the confusing world of aesthetics and cosmetics. Big sigh. So if you followed me for a while, you know how I feel about the industry in the UK for cosmetics and aesthetics. It's embarrassing. I am embarrassed to work in this industry because it is completely unregulated. Around the rest of the world in the UK, only medics are allowed to inject, and yet in the UK, you can just, get up, in the morning, go into your garage, inject someone with a prescription drug, get some money for it, and that's absolutely fine. The government don't care. So, surprise, surprise, we now have an outbreak of botulism in the northeast of England because a practitioner has injected around 28 patients with what's thought to be an illegal or unlicensed botulinum toxin. So they use the word Botox here, but Botox, let's remember, is a brand name, a bit like Dyson vacuum cleaner. So they're just using this because the public know that term. It wasn't actual Botox, which obviously is a regulated and legal toxin in the UK. So what's happened? The patients have likely been injected with an illegal or unlicensed toxin. Therefore, we don't know anything about the quality of this product, whether it's been tested. When we get Botox into clinic, so Dr. Agra and I, this is heavily purified and diluted in a form that we know is completely safe to inject into our patients at a cosmetic dose. What's happened here is they've received something which may not have been purified or even diluted, we don't know, and therefore the patients have received a lethal dose of that toxin. And the symptoms of this can be slurred speech, poor vision, trouble swallowing, trouble breathing, even paralysis, and it can lead to death. So, this is serious problem that these patients have got when they've gone to A&E. So what can you do to stay safe? Well, there's several red flags here in the article. Somewhere I think it said that the patient received 3 areas for £100 previously. This is a huge red flag. I can tell you fact that Botox costs more than £100 for me to buy in per vial. So if you see an advert for Botox, anti-wrinkle, 3 areas, 95 quid, it's not Botox you're getting. It will be some other knockoff or dupe. So that is an instant red flag. Then I think somewhere else it said that she won a competition. Again, this is not allowed in the UK. You shouldn't be incentivizing or promoting the use of prescription drugs. So what can you do to stay safe? First of all, always go to a medical professional. Make sure you see a prescriber face-to-face who's going to do the prescription for you, who takes a medical history and seems professional, and expert and clean, etc. Ask when you're in the appointment room, what am I having today? What type of toxin are you using? Ask to see the box. If they say, oh yeah, it's Botox, ask to see the box. The practitioner should have the box and it has a hologram on it. They should be able to show you all these kind of telltale things that prove it's Botox. If they say, oh, it's like Botox, again, what is it? I'd like to see, please. Have a look. And again, a big red flag is going to see someone who is not a medic and yet miraculously they managed to get hold of some Botox for you without seeing a prescriber. Again, this is all very, very dodgy. Please stay safe out there. See a medical professional.